really get exposed is during training. And so we conduct a 30-hour training with everyone in the program, give them a sense of U.S. healthcare, infection controls, accrediting agencies. So some of these lectures won't be new information for your clients, but it's something that will help them level set and understand U.S. healthcare.
Yeah.
We go through positioning patients, we go through aspects of care, death and dying, motivational interview. It's a very robust training that they must complete. It's about 30 hours, and then there is a instructional period where they have to demonstrate capabilities. So they know how to reposition a patient, they know how to take vital signs, things that your nurses probably know how to do already, but we just have to make sure that from our perspective they're competent to perform. They have to pass a test in writing, a written test, and then they also have to pass the practicum demonstrations.
Mm-hmm.
So once they pass those two things, then they're in the program, and they would go into the facility. So the next opportunity is really all hands-on, all clinical exposure. In our traditional program, our scholars are in the facility 4 hours, at least 4 hours a week, every week, until they complete about 280 hours.
280.
Yes.
Okay.
So there is an hour requirement, and some of our students are in different programs, so they may do 2 4-hour shifts a week, or we have intensive programs where they would be in the facility for more hours a week because they're trying to collapse the time frame.
Okay.
So they can complete it in 3 months, or they can complete it in 9 months. We have summer programs, we have winter programs, so it really depends on the time frame of the individual.
Okay.
But it's the traditional program is 4 hours a week.
4 hours a week. So, I have 2 questions.
Sure.
First is, where will be the lectures at? I believe you have a partnership with University of California in Los Angeles. I watched some videos, but I want to verify with you. Is it on UCLA campus or Cope Health Solutions? And how are the students placed in the facility? Remember that when we talk about facility, it is the hospital.
Yes.
So
Yes.
can you take us through that?
Sure,
please?
sure. So it really depends. For our international programs, some of the training occurs at UCLA. So the programs vary. The traditional program, all of the training occurs at the client site, so the hospital. For the international programs, we have a very focused international program right now. The training occurs at the client site, but they also have lectures at UCLA. So it really depends on how customized the offering is, and the students may have classes at the client site, the hospital, and at UCLA. So it depends, unfortunately. That's the answer. In our classic program, all of the training occurs at the client site.
Client site. Client site is Hospital. Oh, so everything is done in the hospital. I think for nurses that's even better, right?
It is. And what we're focused on is giving them the experience that they will actually have, that's representative of the floor that they would be on. Okay. So once you've passed training and passed your tests, then you rotate through different departments. So every 3 months, and it can be customized, so the time frames might be shorter depending on what your clients are looking for. In our classic program, every 3 months they go to a different department. So they may start, and by department I mean unit, if I speak nurse language.
Yeah. I'm sorry, not a nurse.
No, that's okay. So they may start in a medical surgical unit or a telemetry unit, and rotate through that unit for a period of time, and then they progressively get exposed to more acute patients, or they might go to an ambulatory setting where it's a clinic, so they get exposed to the clinic setting to understand what happens between the hours of 7 and 7 or 7 and 5, which is remarkably different from an inpatient setting. So we really try to expose them not only to inpatient care but ambulatory care, so that we are covering the continuum of care.
Wow. So are they partnered with someone in the hospital? Like, I know there are, like, say for example, shadowing, if the student is not as good, say for example in English, and needs guidance for that. They're going to be doing shadowing instead of like
hands-on.
Yes,
so we really are looking, if you're going to be hands-on, we need to make sure that you are safe in that setting and proficient in English, so that you can understand what is happening, and if people are giving you directions, you understand what the directions are. So that's the aspect of hands-on care. Shadowing is really a lot of our international students that are not as proficient in English are really in a shadowing role. So that means they will follow and observe and not participate in a hands-on fashion. So it really would take us understanding kind of who you would be bringing over and what they're looking for as an experience, so that we can tailor it. And make sure it's appropriate for them. We want them to have the best experience as we tailor things for all of our students. So our high school students, we have a high school program. Our high school students are in observation mode only.
Okay.
So they don't put hands on. They really work with our scholars to observe what they're observing. It gives them a great...
So these are high school students who are thinking about pursuing nursing.
Or who are thinking about medicine. It's really an opportunity for them to, take what they see on television and attach it to reality. And to really then understand, is it a career in sciences or medicine or nursing that I'm interested in? And now I understand what a nurse does. Now I understand, what a radiologist does. Or now I understand what the nurse anesthetist does. So there's a great level of exposure that is afforded in the program.
So say, for example, there are clients who are already are physical therapists. Because I know some people who are physical therapists. Can they apply for the program?
Sure.
I mean, what are there a different category of which facility they'll be placed to? Because
right. So our students come from all backgrounds and disciplines. The program isn't tailored to discipline. Except for nurses, because there is, an upcoming nursing shortage. But students that are interested in being a PA, and sometimes even being a clinical social worker or being a dietitian, enroll in the program so they can understand what the opportunity is, so that they can be seen by that employer and get a job, because it is truly a workforce pipeline program. And so they can make some career decisions. Yes.
Career pipeline program is, I think it's only COPE who's doing this in the U.S., is it?
Yes. Yes. It's a phenomenal program. When I learned about it, when I joined the firm, I was really excited, because I have a lot of friends who started down the path of nursing and enrolled in nursing school and then went to clinical and then said, oh no, this is not for me. And so this program really helps them understand if this career is for them.
Yeah, and not only that, even those who are already nurses.
Yes.
And wants to have an opportunity to find a job.
Yes.
It's like they train you and then they give you a job.
Great exposure, and they get exposure at the highest level, because our champions, the partner, in the facility is usually the chief nursing officer.
Wow.
And so she or he is very aware of our scholars and who they are, and we participate in different events at the facility, so you are constantly exposed, and they inquire about, what is the future of Dawn, like what is she thinking about doing, because you're on their radar
Wow.
as a great employee.
It's very personal.
It's very personal. There are a lot of students there, but they get exposure to the chief nurse of each unit and the department leads. So there is a lot of exposure for our students, our scholars in the program. And our scholars range in age from 18 to 60 something.
Wow.
So it's wide open to anyone who's over the age of 18.